Most American parents have the peace of mind that comes with having health insurance. They know that if their child gets sick, or if they get sick or are hurt in some kind of an accident, their medical needs will be covered by their insurance company. Unfortunately, however, a very large number of children in America and in West Virginia have no health insurance whatsoever. There are 10.5 million children in America and over 70,000 children in West Virginia who do not have any health coverage. That's wrong. It's my general thought, if you don't have health care, you don't have anything, no matter what else you might think you have. And it was certainly true in Emmons, West Virginia. Most of the people who don't have health insurance, the kids, their families are working.
It was the working poor, essentially, who were left out and did not have access to coverage. Coverage and access go hand in hand, and there was just a lot of unevenness across the country. Actually, the story of CHIP was pretty amazing because legislation was introduced in the spring of 1997 and actually got enacted and signed into law in August of that year. So by most standards, that was pretty quick. There was a long history for the members who were very active on this issue, who had been advocating this for a long time.
We had the whole world against us when we were doing the Children's Health Insurance Program. John Chafee, Republican, Rhode Island; Jerry Rockefeller, Democrat, West Virginia; and a guy named John Dingell, Democrat, in the House. Powerful, powerful person. We formed ourselves a little squadron, and our staff worked together all the time. Bipartisan, always bipartisan.
Senator Rockefeller and Senator Chafee introduced a Medicaid expansion proposal. Senator Kennedy and Senator Hatch, who introduced a bill together. Their legislation would have created a block grant program. But we knew we had $16 billion, and we were trying to figure out, how do we spend $16 billion in the most cost-effective way? What was so remarkable about that time was that they weren't wedded to each of their own proposals. They knew that they had to work together ultimately to get legislation passed. So Senator Rockefeller and Senator Chafee worked with Senator Hatch within the jurisdiction of the Finance Committee, and they basically melded together the Kennedy-Hatch proposal to the Chafee-Rockefeller proposal. Unfortunately, the governors were alerted that this amendment was likely to pass, and they did not favor it. They wanted more flexibility than was already in the proposal. So we actually failed on our amendment, but what Chairman Roth did was say that states could decide to do Medicaid, or they could do their own separate program through a block grant, or they could do both. And that passed on the Finance Committee and the Senate floor. We started out the negotiations with $16 billion. And then the Finance Committee worked through the night, members only. Basically, they asked staff to leave the room. And during, the rumors were 2, 3 o'clock in the morning, Senator Hatch stood up and made an impassioned plea to expand funding even further and paying for it with the cigarette tax. So we actually ended up with $24 billion over 5 years on spending for the Children's Health Insurance Program.
On August 5th, President Clinton signed the State Children's Health Insurance Program into law. $24 billion in new funding was authorized to expand children's health care coverage over the next 5 years. It's one of the happiest days of my life. This year we took a very important step towards that goal. But to finish the job, each state has to work out their own plan to insure their children.
The important thing about the CHIP program is that it was a hybrid between commercial. It wasn't commercial insurance, it wasn't a full-blown entitlement program in the way that Medicaid was. It was kind of a blend of those two things. There were a lot of difficulties initially with helping to determine eligibility for CHIP families. It seems strange now considering how popular the program became, but at that time you felt like you were literally trying to turn over one rock at a time to get the word of mouth out there to bring families in. Some people in the early days were thinking, well, maybe you had to be on welfare to get CHIP, and it wasn't like that.
Medicaid had a stigma, but in the 90s there was also lots of changes to welfare. And what we understood was that helping people move from welfare to work required coverage for children, for health, because that was one of the things that people would lose if they went to work. We were hoping it would be destigmatized because it would have a new name and it wouldn't necessarily be at the welfare office where you got the benefits. We would make it available, you could sign up online. That was huge, not to have to go to an office. And the good news about Medicaid and the good news about CHIP is that if you have Medicaid, if you have CHIP, or you have private insurance, those kids are going to the doctors at the same rate.
One of my early recollections about being a CHIP director was going to conferences. You would hear school nurses or physicians and others talking about how grateful that they were that CHIP coverage had come along, that they had been at a loss sometimes to be able to serve those children without insurance, and that meant that those kids might not get screenings like for vision or hearing, as well as they didn't use wellness services generally, and they tended to just be lower utilizers of medical or dental services that we know are really important for kids.
So when the Affordable Care Act was being debated and considered by Congress, there was a lot of discussion on whether or not we would need CHIP, since a lot of children would now be able to get coverage with their parents' private insurance coverage. And Senator Rockefeller was very committed to say, you know, this is a brand new program, the Affordable Care Act. He was a strong and continues to be a strong supporter of it, but thought, you know, for kids, let's keep what we have right now. The other thing that's really important about CHIP is its benefits package, which are designed for kids. Those benefits are often not in other private insurance plans, and we are still now not sure what's going to happen in the Affordable Care Act. So I would say that the CHIP program is more important than ever.
It was always surprising that it was such a small program and enjoyed such strong public support, but nonetheless there has always been this contention around whether or not it should continue.
It is currently slated to expire on September 30th of 2017, so this year. Congress needs to act quickly to reauthorize the program. It's one of the few areas where there still seems to be bipartisan support to keep coverage for children.
One of the things I'm most proud of for our state is that with CHIP and Medicaid together, we now cover 97% of all of our children. One thing that I'd like people to think about is that CHIP, while small, it really gave a very special focus to children's health care and elevated it both in the public and the policy level. And without CHIP, I think we all have to wonder and think about how we would continue to keep that focus on children's health. If we do not resolve the problem of what we replace the ACA with or how we fix it, children will lose out. And I tell you, that would just be heartbreaking.
"10 years from now, we'll still have to fix some things, but 10 years from now, people are going to say, what was all that fuss about? We've got a great healthcare system." You don't think that makes me happy? It does.